Pilates helps people with herniated discs by helping them to strengthen their core. And what is the core? The core is made up of four muscles. We have the pelvic floor, we have the transversus abdominals, the diaphragm, and the lumbar multifidi. So those muscles work together to keep our spines lifted and keep our posture at its best. So when we're dealing with herniated discs, we really want to work on muscles that are going to help lift your vertebrae up off of each other, so that we can create space in those vertebral discs, so that the clean oxygenated blood and all those nutrients can get in there and heal and recover faster. But that goes for anybody with lower back, not just herniations. Sometimes we just have maybe one side of our back that's stronger than the other, or tighter, overworked and underpaid is what I like to say. So working on those lower back muscles with those other muscles that I mentioned will help you to keep those vertebrae lifted up and keep them from compressing and having nerve pain. In Pilates, we talk about the core, and maybe your doctor has mentioned strengthening your core, and it's like, what is that? What does that mean? It's not just your abdominals. It's not even those six-pack abs, those superficial ones. It's those deep abdominals that lay underneath those six-pack abs and those obliques. They are the abdominal muscles that kind of wrap around and support your low back, as well as your organs, and they work with those lumbar multifidi to keep you upright for longer periods of time. So now we have these long days. A lot of times we're sitting for work, or we're just sitting watching TV. But we tend to kind of compress and slouch, and over time that causes the vertebrae to collapse into each other and causes that nerve pain. So Pilates will help you to identify what those muscles are, strengthen them, and alleviate that pain.